MQR, and it's pleasure to welcome you all for today's very important awareness session on stroke. Today, as you
Recording
are
in
aware,
progress.
29th October is observed globally as World Stroke Day to highlight its serious nature and high incidence globally. It also aims to raise the awareness about the prevention and treatment of stroke to ensure better care and support for the survivors. And at MQR also, you are aware that we have always been at the forefront of awareness programs on stroke. Our BUs are constantly working through various programs to spread awareness about the stroke, and therefore it's all the more important for all of us to be aware and get educated on the various aspects of the stroke. And to educate us on stroke, we are honored to have with us today highly esteemed expert from the field of stroke, that is Dr. Nirmal Surya. I would just like to introduce Dr. Nirmal Surya, sir. He is very well known in the field of stroke. His special interests are in the epilepsy, stroke, and neuro rehabilitation. He is affiliated to various prestigious hospitals and institutes currently, and was also associated with various institutes in the past. So he is affiliated to Bombay Hospital and Medical Research Center, Mumbai, Saifi Hospital, Mumbai, North Court Police Hospital, Nagpada, and he has been the founder president of IFNR, that is Indian Federation of Neuro Rehabilitation. He has been the past president of IAN, that is Indian Academy of Neurology. He is president of ISA, that is Indian Stroke Association, and president of Asia Oceanian Society of Neuro Rehabilitation. He has membership of various prestigious organizations, and also a recipient of several prestigious awards, including Mahatma Award for Social Service by Mahatma Gandhi Foundation, then Association of Indian Neurologists of America Award for his outstanding contribution to the field of neurology in 2020. He has also received the Lifetime Achievement Award by National and International Compendium New Delhi 2020. Also a recipient of Samaj Ratna Samman Award, Vijay Ratna Gold Medal Award, Dr. APJ Abdul Kalam Sadbhavana Award, and various other prestigious awards have been, given to Dr. Nirmal Surya. There have been 50 plus publications to his credit in various national and international journals. He has also written 9 chapters in books, including the textbook of neurology by IAN, Parkinson's disease, and a movement disorder. He is editor-in-chief of journal IFNR and editor-in-chief of IFNR, a textbook of neuro rehabilitation, and on editorial board of 7 international journals. So with this, I would like to welcome and invite Dr. Nirmal Surya sir to address us and educate us on stroke.
Thank you very much, Dr. Sachin, for very elaborate introduction. It's indeed a pleasure to partner and work with MQR for last 6 months, and it has been a great journey. And I would, if allowed to share my PPT, I would share the presentation to. Let me go back. Yeah. Now I will share again. This is. So we are going to talk on the occasion of a World Stroke Day on a partnership which we have worked out with MQR in past 6 months. Indian Stroke Association, I thought that we should do something where people should be serious about the stroke. And with that note, I thought if we talk about brain attack as we talk about the heart attack, people might get a little bit serious. So with that note, we started a joint program with API and HCP as Mission Brain Attack. And I think you can see that the disease prevalence is high. Ischemic strokes are the one which is much more common, 85%. And acute stroke within 4.5 hours reaching is very, very less. So in fact, data are saying that we are only doing from South India or one or two states, 3.5% patients are undergoing thrombolysis. So number is very high, but yet we are not able to do thrombolysis in many patients. We are only achieving 3%. At least we should go beyond 10% by the end of my tenure. So that is what I'm looking at as we are seeing about every 4 seconds, we are seeing a patient of stroke. In all, 1.8 million people suffer from stroke in India. And every 4 minutes, there is a one death occur because of stroke. And therefore, we have a huge number of stroke. And there are a lot of challenges because there's no awareness among masses. I remember a couple of months before, Manish one day called me up that one of our representative mother is lying in the OPD at BHU with the stroke. His father had a stroke couple of months before, and he's disabled and bedridden, and now mother has got. So I called up one of the doctor in BHU, and we started the treatment. The question was, even from MCure, people were not going into the golden period when they are knowing that tenecteplase is the drug which should be used intravenously, easy to use, simple 20 milligram. And it is just to be pushed into the IV, and yet they were not reaching in the golden hour. So even my colleague from BHU asked him, why you not come in golden hour with the thrombolysis? So that means we are still not aware that we can do something, or we have no confidence that this is possible. For primary physician, there are no training. They do not recognize the stroke early. And then if they even recognize, by the time, they don't refer to the stroke ready hospital. And there are lack of infrastructure. Most ICU do not have adequate facility for the stroke care. For the consulting physician, there is a lot of understanding and fear that though they have been using it for myocardial infarction, but when it comes to the stroke, they are very fearful that maybe it will cause hemorrhage. And if a couple of patients had hemorrhage, they are very fearful not to use it. So the stroke team member, there is a lack of training program, but many hospitals started Code Red, and that has been really working well, particularly people like Ichapuria in Pune has been able to door to needle time is 14 minutes, which is amazing. So hospital, there is lack of appropriate infrastructure required for a stroke care is missing. If you look at, as mentioned to you, the thrombolysis in India, 3.6% from North India and 3.4% from Hyderabad. And the various reasons are there, but common barrier in India is delay in thrombolysis, including the time loss, consulting with a family member or a local doctor, because the people are not able to take a decision when doctor tell them, can I start this IV treatment, which has a 1% risk, or you can take it. Many times they are indecisive and time is lost. So with that objective, we wanted to have a series of scientific program under the Mission Brain Attack, provide the end-to-end care, train the physician and up their knowledge about the prevention, risk factor, symptoms for early prevention, and identification of stroke through the BFAST. So how we started end-to-end care? So I said we will have 3 arms. Arm first will be about the primary prevention, and arm 2 is management, and arm 3 is long-term rehabilitation. So these all 3 goes hand in hand. So what is the arm 1? Arm 1 is primary prevention. So you need to control the blood pressure, manage the diabetes, lower the cholesterol, quit smoking, maintain a healthy weight, regular physical activity, alcohol in mild to moderate amount, if cardiac issues to be managed, AFib to be managed, and healthy diet. So primary prevention has to be given very important because in the West, the incidence of stroke has reduced largely because of control of primary prevention as compared to the India. Also in India, the stroke is much younger, 10 years younger as compared to the other part of the world. The acute management, again, I mentioned, recognize the symptoms, raise awareness about the symptom, and what are the symptoms. So we have developed this BFAST. MCure only has worked hard on it to develop in 15 languages with a QR code. So that really is working. With that, people are able to understand. And immediate recognize activation of emergency once there is a symptom, rapid transport, urgent CT scan, or MRI wherever possible, intravenous thrombolysis within 4.5 hours. And if there's a large vessel occlusion patient not improving, go to the specialist hospital for the thrombectomy. Even if patient by the time reaches to start the aspirin, at least manage the pressure, sugar, stabilize oxygen. And the third arm is long-term rehabilitation. And those patients were left out. Nearly 40% patients have disability. And this disability can be permanent or can be long-term. So they have to start early rehabilitation with the team of multidisciplinary, which include physiotherapy, speech therapy, occupational therapy, neuropsychologists, etc., etc. So our main aim is train the physician to recognize stroke symptoms early through the BFAST, get the CT scan, check sugar. If all normal, go ahead with tenecteplase 20 milligram bonus. If no improvement, please note that many physicians are already using the drug for MI. So the program was planned and started from Varanasi on 12th May, the first program, and then continues further in many areas. So, and we also launched the Stroke Awareness Month on the this month at New Bombay. And these are the programs which we started. So now, by now, we has already 13 program already done. There are 12 to 13 more lined up all across the country. This is incomplete. Here there will be a program in Udaipur, Srinagar, Bhubaneswar. So a lot of other programs are already been on. And both we have tried to do a hybrid meeting wherever possible. And wherever not possible, we just did a physical meeting. And if we add here the Chennai, we nearly now 75 to 80 people, physician at Chennai. And online has been the highest in the first program, but slowly they have stabilized. Chennai, they were even less. The thrombolysis last few months has been there. And this is the summary of lysis done in cities where was Mission Brain Attack has been launched. So now we have more than 4,000 physicians attending between physical and virtual mode. This is from Nasik. These are various programs which you can see that many more physicians and active has been. And this everywhere we go, we do the press conference to impress upon to the society about the need of the therapy, need to recognize early, and what is the impact. Just look at the impact at various places. The lysis has increased after the, and mind you, these are done by the physician. So nearly 37 lysis has been done in past 6 months by the physician in the various remote area. And the feedback for the session has been extremely good. They have been very motivated. They liked the program and they got more confidence. Some of the doctors from the remote area who have used in after the session has given their testimonial. So we have started the Mission Brain Attack on May 24. We have launched the World Stroke Month from Navi Mumbai on 6th October. We are able to train around 4,000 physicians, and we plan to continue this for next few months till we achieve a goal of reaching out to 25 to 30,000 people. The most important thing is we want to launch the stroke app for the thrombolysis and early recognition and guide for the physician. And I'll be very happy if we can launch this as soon as possible, much before the January API conference, so that most of the physician can enroll and ISA would be able to guide them. So with that note, I think I've given you a view that how we have been able to recognize, train physician, reach to the press, reach to the common public. In each press meeting, we call the patients. The press can interact with them, those who have received thrombolysis, those who have gone through the thrombectomy, and their own version of how they are saved of the disability and come out over the life where they felt that they would no longer be able to live, has made a lot of difference to the society. I think the effect will be slow, but if we continue this, the impact would be much more. And my request to all of you is, please keep this QR code, share the mission, the BFAST symptom to all your friends, all your relatives, so that they start at least know that there could be a stroke, go to the stroke ready hospital, get treatment in the time. Thank you very much.
Right, sir. Right. Thank you so much for that very simple, lucid presentation and very well explained. I must compliment you for your all the effort that you are taking, sir, for spreading the awareness. I also thank you for acknowledging the efforts of MQR. MQR has also been, part of various awareness initiatives, and all of those are, being taken care of by Manish and his team, and under the able leadership of Mr. Shailendra Tyagi, who has joined us, who is heading the chronic cluster business. So welcome, Shailendra, for the program. Also, we are having, sir, our HR head. He also has, made it possible today to, make the QR code available to all the employees. So in front of all the employees, we are today having the QR code of this BFAST, so that the efforts are, as you rightly mentioned, the continuous efforts would be, impactful, though it would be, slow. So yes, sir, we would, continue to take efforts to spread awareness for in the field of stroke. Sir, I would like to ask you questions which would be, useful for our employees to understand better in terms of the prevention and care that is required to be taken for stroke. You in fact rightly mentioned about the window period. Many people, even the employees of MCOR, would not be aware of the importance of window period. So would you like to throw some light on window period? Why it is so important? What is that period, and why should we, take care of it?
Though, as you know, that once the ischemic stroke happen, the clot uh, causing the circulation in particular area of the brain stop, the nearly 1 million cells start dying every minute, and there become a penumbra, which is a area around the core circulation area, which can be revived within 4.5 hours. This was 3 hours few years before, which has been extended into the 4.5 hour. The question is not 4.5 hours. The question is how early you can go. If you can go in half an hour, the damage will not be more, because as the circulation affects, the more and more cells started getting dead. Because as I mentioned to you, 1.4 million cells are dying every seconds. And so the millions of cells will be dying. So if you can reverse it or not allow the cells to die as earlier. But what we have found is 4.5 hours is a period by which the recovery is possible, where penumbra still can be made to revive. That is the reason we are now talking of 4.5 hours, because many people would leave the patient after 3 hours, where we have found that even after 3 hours, giving the IV thrombolysis has made a difference in their outcome.
Right. So that's the importance, and we have to, take care of that, window period. But sir, if if we, talk in terms of layman's language, how would a person, normal person, identify quickly so that he can take care of that window period? Would there be any, important, points to, remember to identify the patients, quickly?
So any weakness on one side happen is always because of disturbance in the brain. So, if you have face weakness, speech disturbance, hand and leg weakness, not able to lift, or the balance on one side, which you never had before, it should be taken that, because as you know that the circulation is such that it either will go control the left half or the right half of the brain. So one half of the brain will get affected, so the opposite side will become weak. So even in the vision loss would be in one eye. Speech sometimes can be completely lost or can be dysarthria because of depending on the which side of the brain is affected. So by and large, anterior circulation are much more common, and therefore the symptoms are usually on one side. But if it is in the posterior circulation, which is a little less common but much more severe, there the patient can develop weakness on both sides of the body. And many times patient get warning sign, like you get angina, chest pain, you rest, get better. So we call them as transient ischemic attack. So you get a weakness which lasts for few minutes, few seconds. You do massage or you do something, drink something, sugar and all, which is what most people do, and you get better. And then you say, no, this is okay. Don't miss out that, because invariably after a transient ischemic attack, 40 to 50% patient get stroke within 24 hours to 1 week. So TIA is a warning sign. If anybody get a weakness on one side of the body, and if you are a hypertensive diabetic, so you know that you got a risk factor, you know that you could get age, if there is family history, you are at a risk. Do not take it lightly. Go and see a physician or a neurologist. At least rule out the stroke until unless it is proved otherwise.
Right. So he has to go to the physician quickly once he, suspect such type of, the attack is there. But after that, if we talk many times about the stroke ready centers, that is also, term that is used, commonly nowadays. So would you like to throw some light on what are the stroke ready centers and how do we, check where are they,
Stroke ready centers, fortunately, under the Indian Stroke Association, has been able to certify the primary center as well as advanced center. So they get a accreditation where every facility to treat acute stroke is there. But if you are in a remote area, you are in a district area, you must go to a place where there is a CT scan, there's an ICU facility, and there is a physician available immediately. And because if you have any of these symptoms, that means you have to do a CT scan first. If CT scan has to be normal, because that rules out the hemorrhage. That means if hemorrhage has been ruled out, 85% chance is that it is an infarct. Check your sugar. If it is sugar is within normal or higher side, check your blood pressure. It is not very high, not above 110 diastolic and 180 200 systolic. I think you are a candidate for the IV thrombolysis. The doctor, if cannot give, go to the place where this treatment is available. The best thing is to go to a neurologist if available in your city, in your place. But don't waste the time in traveling. Tell the physician to speak to neurologist, because time is brain, as in be fast, T is time.
right? The time is brain. Sir, you mentioned about couple of risk factors in your previous answer, diabetes, hypertension. So what are the risk factors that the lay person should be aware of as a risk of increased risk of stroke?
So there are risk factors which you cannot control, which is genetic. So you have a family history of stroke, diabetes, blood pressure. You cannot control that, but you can certainly control your sugar. You can control your blood pressure with the medicine. If you are obese, you can reduce your weight. You can check your cholesterol frequently, regularly, lipids, and control the lipids. If you are smoking, smoking is a highly risk factor. So even if you don't have blood pressure, diabetes, and you're smoking 2 pack, 3 pack a day, you are at a very high risk of getting the stroke. So smoking should be quit. Alcohol can be tried. Social alcohol once in a week, 1 or 2 pack is allowed, but heavy alcohol is again a risk for the stroke. And one should normally do regular exercise, which is good for brain health. If you look at brain health, good exercise, good food, good sleep. So you need to have good, proper 6 to 7 hours sleep, proper balanced food with lot of fruits, vegetable, fish, and regular exercise, half an hour a day, at least 5 days a week.
Right. So these are the risk factors. Now, sir, there is one more risk that is, frequently spoken about, especially in recent past, post-COVID. I mean, there have been, saying several. It has been linked. I mean, COVID vaccine has been linked, several times to the stroke. What do you have to say about this? Is it really linked to the stroke vaccine,
So
COVID
again,
vaccines?
the COVID vaccine or COVID, again, the risk factor, this has affected those people who have risk factors. So those who are diabetic,
Okay.
hypertensive, because there's a coagulation process which get affected. So your blood become more thicker and likely to get more clot. So if you can control those risk factors, I think you are at a much better. There are some people who, in spite of no risk factor, can develop the stroke because if they have a arrhythmia in the heart, or there's a small PFO in the heart, or there is some other coagulation disorder, which are not very common. They are into the 1% to 5% cases. But if you are having no risk factor, yet you are developing a stroke, one need to rule out, look for the heart causes, look for the coagulation profile and certain inherited causes.
Right. So related to this only, there is one question from one of our employees. So there seems to be an increase in stroke among the young individuals. So what factors do you really see that are contributing to this, and
This
what
is
precautions they
lifestyle.
should take? Yes.
Lifestyle. So younger people, all fast foods, they are not eating proper diet. More of McDonald's, KFC, all that French fries, fast food. No exercise. Not many of them are doing regular exercise. The stress level is very high today because there's a lot of competition. Everywhere is stress. And you will find that 30-year, 35-year has a hypertension, which was not before. Before we were talking of blood pressure at 50 years. So basically the lifestyle changes which has happened in past decades is the cause of younger stroke in India.
Right. So then, so what do you suggest, to all regarding the lifestyle? I mean, in daily
So do
routine.
regular walk, follow your diet pattern, have a proper sleep in the night, do some yoga, meditation, because that's how you can take the stress of your life, because stress is going to be there. You're moving into a very competitive world. So you need to relax yourself, do some yoga, meditation. So these are the way you can keep yourself fit and better health.
Would there be any specific instructions in terms of daily duration of the activities, in terms of physical activity? Like every year, World Stroke Day comes up with some, theme. And this year too, they are, talking about the greater than a stroke theme. So would there be any specific instructions from your side in terms of daily physical activity, in terms of the duration, or any other suggestion?
See, I would only say that everybody has his own body. He knows how to do the exercise. I don't want to put up that you should run on treadmill for half an hour, or you should run 10 kilometer, or you should do that. I think everybody has to decide how
Right.
his body is reacting. Like I walk 50 minutes, at least 6 kilometer, almost 3 to 4 days a week. I do 15 minutes of gym. That's it. So I balance it. The day I only do half an hour gym, I don't walk much. I do only 30 minutes walk, depending on what is my mood that day. It should not be monotonous. What you enjoy, you should do it. So basically, whatever exercises, physical activity you do, you must enjoy that, not under the force.
Right, right. So this is about the prevention and lifestyle changes we just spoke about. What about the patients who have just experienced the stroke? They have come out of the stroke. Is there any precaution that or any care that they need to take to prevent further complications?
Remember that the stroke has happened, there is some area of brain has damage. It's all up to you how you create a connection from a normal area into the damaged area. So you should not be losing the hope. You should go to a proper rehabilitation program, work in such a way that your connections develop, work hard to get those connections. As you can, you motivate yourself. The most of the patient get demotivated, get into depression that why I develop, why I have to develop. I was doing so much and I got this. I will not be promoted. But they should have an aim that, okay, I got it because there was certain risk factor which has happened. I could not reach in time, say, for thrombolysis, my bad luck. But now what I can do to get better is how they should start working on that. And I can assure you that with proper rehab program, 70-80% patients go back to the normal properly within 6 months to 1 year time. So there should not be end of the life for them. There are so many new gadgets are available. The robotic therapy, brain computer interface, transmagnetic stimulation, so many new rehab programs are available. So they must go to a proper rehab setup which treats the stroke to get the best out of it.
Right. So there is one question which asks for patients who experience paralysis due to stroke, what factors determine the likelihood of full or partial recovery? And you just spoke about the rehabilitation. So rehabilitation, someone is saying it is costly treatment, and what can patient do in such scenario?
So now what we are trying to develop is we are dialoguing with the government to develop the low-cost rehab equipments and program. There are not many experts are available. The similarity or the minimum standard of treatment are not being defined in this country. So we have a lot of things to do, but I must assure you that things has been improving. I know it is very expensive, so we are trying to develop them in the government and municipal setup. The tele rehab and home-based rehab is something which is coming. We're trying to develop various apps for the rehab, particularly for the speech, cognition. So in next few months, few year, you'll find that low-cost rehab equipments will be available. The rehab would be much more widely available at various places, and it will definitely help to reach out to the people who have not able to get those and reduce the disability.
Right, that would be great. There is one question, sir. Is it possible to have a stroke and not realize it?
Most of the people do not realize because they think that sugar कम हो गया, कल मैं travel करके आया, exertion हुआ, बहुत काम किया, but they didn't realize that because of that their pressure has gone up, and that has caused. And many times what happened, people forget because they are so busy in certain work or involved in certain program that they forget to take the blood pressure medicine. And if this and this is very common. And also common is many people don't even check their blood pressure and sugar for years because they think that they cannot have anything. They have just got the Janam Guti and come to in this world. So they only realize when they get a stroke and they go to the hospital, doctor say your pressure is high, your sugars are very high. So I would suggest that people should at least go for checkup once in 3-4 months for blood pressure. If they get regular reading, then it's fine. If any reading come high, then they should go more frequently. 6 monthly, they should check the sugar so that they are alarmed that, okay, this is something is high. I was not having this and now it is going. I must keep on regular checkup. So that is how you have to be alert and careful.
Right, right. So I think you have explained, I mean, very well, sir. I mean, you have answered all the questions in a very simple manner. And this information would really help us, each of us, in fact, to help in the prevention and treatment, and also to spread awareness. All of us would be inspired really to contribute towards spreading awareness, and as they say, every effort really counts. So I think if there are any questions from the panel, they can ask. Else, I would uh, request Mr. Amol to give vote of thanks.
Okay. So I
Amol,
think,
just 1 minute.
yes, sir.
Sir,
Yes.
in this program, the way you used to take in Stroke Academy the press release, because many employees, families member are also attending the program. So if 1 or 2 minutes again in Hindi, so if you can explain the way you used to explain during the press release, that will be very useful.
So I always say हिंदी की मस्तिष्क में रक्त की नली में खून कम हो जाने की वजह से जो ब्रेन के जो एरिया में जहाँ से कंट्रोल होता है वहाँ से कंट्रोल निकल जाता है, उसकी वजह से आपको पैरालिसिस या लकवा हो सकता है। और उसके कई रिस्क फैक्टर्स होते हैं, जैसे ब्लड प्रेशर, शक्कर का ज़्यादा होना, स्मोकिंग, अल्कोहल, और आपका वजन ज़्यादा होना, और आपका जो है कोलेस्ट्रॉल और ट्राइग्लिसराइड ज़्यादा होना। तो ये रिस्क फैक्टर को आपने कंट्रोल करना चाहिए। अगर आपको कोई भी ऐसा सिम्टम हो जिसमें आपका बैलेंस लॉस हो रहा हो, आप बराबर चल नहीं पा रहे हो, चक्कर आ रहे हो एकाएक, या फिर देखने में एक आंख से धुंधला दिखाई दे या कंप्लीट दिखना बंद हो जाए, या दोनों आंख से डबल दिखाई देने लगे एकाएक, या फिर मुंह टेढ़ा हो जाए या लटक जाए यहाँ से एक तरफ से, आप मुंह में पानी भरना चाहे ना भर पाए, हवा डालना चाहे हवा बाहर ना निकले, और आपका हाथ लूज हो जाए या हाथ में सुन्न हो जाए, ऐसा लगे कि बहुत भारी हो गया है, काम नहीं कर रहा है, या पाँव भी चलने में लड़खड़ाहट आ जाए, और अगर ये सारे सिम्टम हो आपके साथ, और बोलने में कुछ तकलीफ हो, जैसे आवाज निकल नहीं रही है या निकल रही है तो साफ नहीं है, और या जो आप बोलना चाहते हैं वो बोल नहीं पा रहे, वो वर्ड बाहर नहीं आ रहे, तो आपको अलार्म होना चाहिए कि ये सिम्टम लकवे के हैं, और तुरंत आपको एक हॉस्पिटल में डॉक्टर के पास जाना चाहिए जो कि लकवा का इलाज करते हो, जहाँ पर सीटी स्कैन की फैसिलिटी हो, और उनको अगर आप जितना जल्दी जाएंगे 4.5 घंटे के अंदर, जिसको गोल्डन आवर बोलते हैं, आपको वो इंजेक्शन देने से रक्त में जो क्लॉट आया है उसको डाइल्यूट कर सकते हैं। जैसे नाली में कचरा जमा होता है, कैसे हम पाइप से भी निकाल लेते हैं या पानी डाल के बहा देते हैं, उसी तरह हम इंजेक्शन देके, जैसे कुछ लोग कुछ पाउडर डालते हैं जिससे कचरा पिघल के निकल जाता है, वही इंजेक्शन देने से कचरा, जो क्लॉट का कचरा है, वो पिघल जाता है। और जिन केसेस में क्लॉट बड़ा है और वो पिघलता नहीं है, तो जैसे आप नाली में पाइप डाल के लोहे के पाइप से वो जो कचरा निकालते हैं, वैसे ही डॉक्टर जो एक्सपर्ट है वो आर्टरी के जरिए अंदर ब्रेन में जाकर क्लॉट को बाहर निकाल देते हैं। तो ये जो है इम्पोर्टेंट स्टेप्स आए हैं, ये एडवांस ट्रीटमेंट हुए हैं हिंदुस्तान में, और इसके कई सारे एक्सपर्ट हो रहे हैं, हर सिटी में करीब करीब आज अवेलेबल हैं। तो आपको मालूम होना चाहिए कि कौन से हॉस्पिटल में ये स्पेशलिस्ट है जहाँ पर हम जा सकें, ताकि टाइम इम्पोर्टेंट है, टाइम इज ब्रेन, टाइम इज टिश्यू, आजकल हम ये भी बोलते हैं, जितना जल्दी आप एक्ट करोगे उतना डैमेज कम होगा। तो यही बताना चाहता।
Thank you, sir. Yeah.
Right.
Yes.
Yes.
Thank you, sir. So lovely explained, and so easy in a layman's language also, which is very important for, us who are not, but generally from organization, people are at different levels and we call ourselves as laymen. But thank you so much for explaining it so well, sir. Thank you. And it is a great presentation, sir, because you address right from what the challenges are and also how important the golden hour is. So that 4.5 hours, how critical it is for a patient to reach the hospital. And there's a great effort also to drive this mission brain attack, which is an end-to-end care and also noble cause mainly to spread awareness. You also explained those 3 arms which are, actually supporting the end-to-end care initiative. So, and we have seen the kind of programs, awareness programs you have driven this last 2 months, and we have seen how, that has impacted also the number of lysis across the country. So that clearly speaks, how impactful the program is. And today also through your presentation, we could see, why it is so impactful. So there's a strong conviction behind that, which is driving this program across. So thank you so much, sir. Thank you. It was great listening to you, and would love to listen to you again and again. But thank you so much for sparing your time and coming here, sir. Namaste. Thank you.
Thank you, sir.
Thank
Okay.
you, sir, for all your time, your passion, your dedication. Every time you come and meet us and you talk about Mission Brain Attack, the kind of passion you show, it is unmatched. So, as a president of ISA, you have taken a lot of measures to drive this Mission Brain Attack. And MCure is always there with you as a partner towards driving this entire mission of Brain Attack, and to bring this, take this flag ahead to masses and make India aware about the stroke.
I think
So we are on the slogan, sir. कि
game
जीतेगा
changer.
India, हारेगा stroke.
Game changer would be the app. Once we
Yes, sir.
get the physician enrolled onto the app across the country, it will change the thrombolysis game. It will be in hundreds immediately.
Surely, sir, we are working on that, and I'll surely update you in a week's time.
Yeah.
So I am in touch with, doctors, those who have created this app. So very soon we'll come back on this.
If we can get that AI of CT also, that will save lot of pressure on the neurologists and waiting for the people to see the CT and revert. AI
Sure, sir, sure.
now, there's an Indian company who is also doing. So how we can get that software?
Right.
Because the ones AI is now for the radiology is superb. So they are better than the human being for
Sure,
CT
sure.
and reporting. So I think we need to, if you are coming out, this will change the whole game.
Sure, sir, sure.
Yeah.
In HR, sir, Praveen has done the course on AI, or he is also expert from our HR side. So we will discuss and definitely we will develop that app.
There are software available. I don't know how to get them. In US, Sanjay Singh shown me. They are very expensive. There's one or two company. I said we'll talk to them if they want to come to India. But I think since you are an expert in IT, you can look at it. There is one company who was there at Abu Dhabi, and they are from India, QI or something. So they also want to serve. So if we can come to a common platform with ISA and help out, benefit everybody.
Right.
Thank you.
Thank you, sir.
Right.
Thank you so
Thank
much.
you,
Thanks.
sir.
Thank you.
Thank
Bye-bye.
you, sir.
Thank you.
Bye-bye. Thanks, Dr. Sachin.